I have systemic lupus, and because of the systemic lupus, it caused me to have kidney damage. So it went over into stage 3 kidney disease.
What did you think of the response you got when you told your story to Congressman Webster?
I don't think I really got a response because they weren't really talking about the cuts that they were bringing into Medicaid and the Medicare. I will be able to get Medicare at this year of October because of the kidney disease, but they didn't really talk about how the cuts of Medicaid would affect people, and they don't really explain to people what Medicaid is. People think that Medicaid is a program for people who don't work, and that's not the case.
Are you worried about what could happen if the budget that Congressman Webster voted for were to become law?
I do worry because I'm not the only one that's going through this, having chronic illnesses, diseases, and without any insurance. If they were to take away the Medicaid, people who don't work and don't have a job, who can't buy their own insurance, what's going to happen with them? Medicaid is not a crutch, but it's supposed to be a program for people who have low income but don't make a certain amount. And I think they demonize the Medicaid system, and they're saying that it's going to, that it needs to be overhauled. And I heard someone speak about how the hospital charge a different amount than a pharmacy. That has nothing to do with the Medicaid system. That has to do with hospitals or doctor's office doing fraud. It has nothing to do with the Medicaid system. I think that if they're going to try to do something with the Medicaid system, that they need to have people that are directly affected who have been on Medicaid to try to help work that out, because they're going to cut out programs that people really need. Had it not been for the medically needy program or Medicaid, I wouldn't be sitting here talking to you guys now.
And you were able to get your treatment?
I was able to get chemotherapy for 2 years. I was on chemotherapy for 2 years because the type of kidney disease I have is called lupus nephritis, and it's a disease that you get only associated with lupus. So it really damaged my kidneys, and there was a new treatment that they were trying to give me because it was progressing very fast. And I had to do intravenous chemo for 6 months, and then the remaining of the time, which was a year and a half, I did pill form of chemo. And then I also was on chemo because the lupus gives me rheumatoid arthritis. So I've been on chemo twice for this disease, and had it not been for Medicaid, I wouldn't be dead, actually, because there's no programs out there that would have taken me. And if it wasn't for my wonderful nephrologist, because most doctors wouldn't take me. So